Again, if it's too good to be true, or sounds too good, it probably is. A pain-free surgery that's outpatient. What you'll hear a little bit about later is that joint replacement and the surgery and the process afterwards, it is a major surgery, and it takes a significant time to recover completely from that surgery. In the last certainly 5 years and probably 10 years, we've made a lot of advances in pain control and anesthesia and therapy protocols that are helping people get better and recover faster with less pain. But it is not a pain-free surgery. And when we look at those implants on the right, no matter the size of the incision or how the surgery's done, through what approach, or how you get into the hip or the knee, in the end we are having to cut bone and put metal material into the body, and so that's invasive. There is pain with that, and it does take time to recover. So minimally invasive surgery goes along with that. We hear a lot about less pain and outpatient surgery, etc. Again, not all new advancements are not new ideas or advancements. We've seen in the history of joint replacement plenty of new ideas that were actually detrimental as we fought them out over time. And so our job is to talk with patients and investigate new things to figure out which ones we think are going to be advances and which ones are not. Minimal incision surgery. There are some studies that we put here on the hip and the knee, just kind of following down. Along the way, different incisions and ways to put in hips and knees have come out, and at first there's sort of a splash. As someone tries it and people do well, it gets advertised and sort of spreads by word of mouth. And there have been different techniques through the years that, as they've been tried by several surgeons and finally studied and compared, many times we find that the outcomes are less than what we would desire. So when we're doing joint replacement, we want to make your pain better, your function better, and we want to do it for a very long time. And if we can't see, or if we put replacements in sort of poor position, it may be well and good for a short time, but not for that hopefully 20 years or longer. So again, we like to pay attention to the literature and see the studies before we make new decisions on that. And as Dr. Christie likes to say, I think this is his slide with the ship in the bottle, function and survival are directly proportional to how well the implant's put in. And we're putting those implants in under direct vision, and we don't want to try to build a ship in a bottle because it may not function well and it may not last for a long time. Thank you very much. I think Dr. Hodrick's going to be talking next. And before he does, I did want to mention that we have some therapists here. We also have some other people from our staff that we want to thank for helping put this together. And they'll also be around for questions. We've got some nurses, some case managers, all right?
Good evening. My name is Jeff Hodrick, and I joined the group about a year and a half ago. And I'm going to talk a little bit about, I think, what we think makes our group special. I don't think we'll pretend to say that I think there's a lot of people that can do knee and hip replacement very well, but I think there's some things that, you know, according to Dr. Christie's vision and the group's vision, there's some things that we put in place as a group that I think can make it a little bit smoother as far as the operation goes. Knee and hip replacement, it's been shown, is a fantastic medical intervention. It's really kind of a life-changing event. I think you'll hear it from the patient panel. It can really make a difference. So if you have knee or hip arthritis, you can feel good that there's an operation that's really going to help you. But I do want to talk about what we do and what we believe in, and hopefully it'll also stir up some more questions. As far as our whole team, Dr. Morrison touched on it. Some are here tonight, and you'll be able to ask them questions as well. If you come to our office, everyone that you're going to meet, because we do joint replacement, that's what they do. So everybody in our office does joint replacement. So if you meet somebody at the front office, they're used to talking to somebody that either needs a hip or a knee replacement or shoulder replacement. If you have a question about billing, you know, they're used to questions about insurance issues. the therapists in our office. That's what we take care of day in and day out. So I think we have a very highly qualified staff that's used to dealing with issues that are related to joint replacement. Before surgery, if you decide to have surgery at St. Thomas, there's a hospitalist program. And what that is, these are licensed internal medicine doctors that you'll see before surgery. And their job is to manage any medical problems that you have. And probably more importantly, to figure out if you need any more medical workup before your surgery. Because there's no surgeon or any doctor that really likes surprises. We don't like to deal with things after they happen. Hopefully you can prevent something from happening after the surgery. So you'll see that hospitalist before the surgery, and then they'll also see you after the surgery in the hospital, and they'll deal with all your medical problems. While we'll take care of the hip or knee replacement, they'll take care of the medical problems, and I think it's a really good system. There's also a joint education class. The purpose of this, again, is to get all your questions answered and put all the tools in your hand to get better after the surgery. Again, the last thing you want to do is send you home after the surgery. After you get home, you're wondering, well, how do I do this? Or I don't have this, or what do I need, and what do I do now? You'll have a booklet with plenty of information, and hopefully all your questions will be answered beforehand, because the only thing we want you to worry about is getting better after the surgery. Some of the things on the day of surgery, we believe in detail, so we want to make sure you know what time you're supposed to be there, where you're supposed to be, where to park, where your family can go with you. We do have a pre-op waiting room that the family is allowed to stay with you until the time of your surgery. Also, our nurses are very in tune in the operating room that they'll call the family during the surgery and give updates. I think this is also important because obviously it's an anxiety-provoking situation. It's a major surgery and you want to know how everything's going. In the hospital rooms, they're all private rooms, and they also have a chair that also folds out into a bed, so it's certainly not uncommon for us to have family members stay in the room. Some of the things Dr. Morrison touched on as well. I think probably one of the biggest advancements in joint replacement in the last 10 years has been anesthesia. It's not really been the orthopedic side, but it's been anesthesia and it's been pain control. And it's been kind of a shift. There used to be, it was a general anesthetic, so then you woke up after surgery and then you went upstairs or you went into the hospital and you'd wake up and you'd be in a whole lot of pain because it's a pretty big surgery. So I think there's been a shift in trying to take care of that pain beforehand. There's a couple ways to do that. Number one is to give you some medicines before surgery that maybe calm down the sensation of pain. And then also all our patients also get a nerve block, for knee replacements, and that's also kind of revolutionized it. So your knee, you're not having the pain of the knee surgery sometimes for 18 to 24 hours after that time of surgery. Narcotic pain medicines are great. There's no doubt about it. They help take care of pain, but they also have a lot of side effects. Those side effects can be nausea. They can also be respiratory or breathing related. So if you take enough narcotics, you'll stop breathing. So those are obviously things that we want to avoid after surgery. So a lot of these other things that we do at the time of surgery help to eliminate those. I talked a little bit about the education part, and I think this is not to be overlooked either. I think if patient expectations, what we found, if you know that, obviously there's going to be some pain of the surgery, but if there's an emotional or a psychological component, you can help control that by not being anxious about the pain. Communicating that you're going to be in pain and you're going to need some pain medicine to your nurses. And the nurses also do a good job kind of controlling the environment, kind of not getting too excited about it. We'll get you some pain medicine, we'll take care of that. Again, looking at the pain rather than being reactive, being preemptive. You want to stay ahead of the pain curve. We don't want to go up and down with the pain. Talked about the blocks, and then after surgery, all our patients are up on the day of surgery. After a joint replacement, you're not sick, you're just injured a little bit. So, the idea after surgery, you're in the hospital for physical therapy mostly, and to make sure that you're medically stable for that day or two after surgery. So we certainly ask a lot of our patients, and we ask that our patients ask a lot of themselves after surgery, and that you want to get better. So if you picture this being, if you're at the beginning of your surgical process and way out there in the mountains is kind of your full recovery, this is the kind of road that we want. We want you to be on that smooth road where you're just cruising along, getting better, and then these are the things that we want to avoid. When we started talking about getting on a roller coaster of pain, it becomes a little bit dangerous. You get into a lot of pain and you're writhing in pain, then you take a lot of pain medicine, and next thing you know, you run into complications. And you certainly don't want to end up like this girl in the front seat. Some of the things in the operating room, we do have specialized rooms that only our group use, and we're certainly lucky to have those, and we also have our own staff. You can see this picture here. One of the things we do with joint replacement, we all wear these specialized ventilation suits or space suits or whatever you want to call it, and that has to do with protection for you for infectious purposes. There's also a system of airflow that directs airflow away from the incision or away from the wound. That also helps to control infection. We use digital x-rays, which is something new, so we're able to template cases so we know what sizes everybody needs beforehand. Again, no surprises in the operating room. All the surgical techs and nursing staff, again, when you're doing the same thing every day, everyone around you gets better at doing the same thing every day, and I think that's what we pride ourselves on. Same thing with our anesthesiologist. We have x-ray techs that also do the same thing, and then the pre-op nursing staff and recovery room staff. Some of our floor team, same thing. We have a wing where all our patients stay in the same wing, so we have the same nursing staff that sees them. Obviously, they're the ones taking care of you 24/7, and we put a lot of faith in them, and they're certainly excellently trained. The hospitalist group, again, are physical therapists both in the office and in the hospital. Get up on the day of surgery, and then we also have, if anyone's seen our unit, that at the end of the hall there's a community room, and we believe in kind of getting the patients out of the room instead of doing therapy there, getting them down into the community room. It's also kind of a little bit social, and I don't think, not too small a part of it, a little bit of not kind of competition. You know, it's kind of like, well, you know, if he can do it, I can do it. If she can do it, I see what she's doing. What did you have done? I see you had a knee replacement. Your knee bends this far, and I think it's actually a really good thing. We also have our discharge care planners, our care management people. Donna Miller's here. We call them our medical concierge team. So just in summary, I think kind of what we're talking about is a highly specialized environment. You know, and we take pride in, you know, providing a service. You know, this is in this day and age, you know, it's a consumer-driven economy. You know, and it's your body. So if you're going to spend 2 to 3 weeks online shopping for a car, I'm sure you're going to do the same thing when you're looking for a knee or hip replacement, and you should. I mean, you're talking about your body and you're talking about your health. You need to do your homework, and I think we do a pretty good job at it.